today in strong opposition to Republican attempts to repeal and dismantle our health care law, the law that Congress has passed to give health care to the American people. Mr. Speaker, this repeal bill may fulfill an empty campaign promise, but it really fails to put the key American objectives of creating jobs and reducing the deficit at the top of the agenda. In fact, the Independent Congressional Budget Office estimates that this repeal will increase the deficit by $230 billion over the next 10 years. And in Maryland, by contrast, we'll save $800 million in 10 years with the new law. We've heard the debate, but now it's time to hear the stories of countless millions of Americans who have a chance at real health care. I know these stories because I hear them every day, Mr. Speaker. Stories like Chuck, an engineer from Hyattsville, Maryland, who suffers from chronic thyroid condition and believes he'll be denied health insurance coverage should health care reform be repealed. Nancy, a mother in Germantown, Maryland, who's grateful that the health care law has allowed her 20-something daughter, currently in graduate school, to stay on her mother's health insurance policy. I've even heard from constituents of some of our Republican colleagues afraid about having to repay the money that they slipped into the donut hole. And I want to tell you about Annie, a friend of mine, 28 years old, diagnosed with leukemia, who would have reached lifetime caps because she and her parents are trying to save her life. Mr. Speaker, it's unfortunate that we're here today. Let's create jobs and stop this theater.
Time,